If you've had a significant injury to your knee or you're struggling to put weight on your knee, then go see a doctor. If your knee pain's been grumbling on for maybe 3 months or so, then that's the sort of time to be thinking about getting some help. And if the pain is catching, mechanical, sharp, the sort of pain that makes you go, ooh, then that may well be that you've got a cartilage tear or meniscal tear that may be helped by keyhole surgery. And a surgeon can help talk you through what that involves and how that might help you. With keyhole surgery, we'll tend to flare things up for a couple of weeks, and then at least that catching element should settle down fairly quickly. You should know pretty soon whether the surgery has helped you. You can look at getting back to work after 2 weeks or so, or if you do a very manual job, you might need an extra week or so. Knee replacement, the recovery is quite tough. You turn a corner at about 4 to 6 weeks. You're back to doing most things by 8 weeks, but full recovery might take 12 to 18 months. You'll be seen by a physiotherapist while you're an inpatient, and then we'll assess whether you need extra physiotherapy as an outpatient. And those patients that need physiotherapy will be brought back for whatever they need.